Now, the 7-day average for coronavirus case numbers across the U.S. have been hovering right around 54,000 a day. Health experts say it's critical to get the numbers lower. Joining us right now is our own Chief Health Editor, Dr. Partha Nandi. Dr. Nandi, nice for you to be with us. You know, more and more people are getting vaccinated every single day. So what are experts concerned about right now?
And Carolyn, here's the thing, right? Experts are concerned that our high infection rates could lead to problems down the road for vaccines. Here's the thing that people are getting vaccinated, but it's a small percentage. So far, only 13.7% of Americans are fully vaccinated. I know it's a little bit higher in our state. And in the country, it's about 45.5 million, and roughly 83.9 or almost 84 million people in the US have received one dose. Now, it's a great start. I think we're doing well, but it's peanuts compared to those numbers of the total population in the US, which is just over 328 million folks.
Now, Dr. Nandi, you said high infection rates could lead to problems down the road for vaccines. Can you explain what that means?
Sure. First of all, we have the B.1.1.7 variant, right, Carolyn, which was found in Britain and it's spreading like wildfire. The fact that it's more contagious means what? It could easily lead to another surge in infections. That will then, if you have uncontrolled spread, can lead to more illnesses, more hospitalization, and more people dying. So if the virus is allowed to spread, it opens the doors for new variants. And remember, viruses, we've talked about this, naturally mutate. Some of the changes are really meaningless and don't affect how the virus really acts. Others could make the virus potentially more dangerous and deadly. And so there's a possibility that new variants could outsmart our vaccines, making them less effective.
Wow. Now, speaking of spread, Dr. Nandi, we've heard that travel and crowds are a real problem, with experts saying it goes hand in hand with surges. Do you agree with that?
I do, and it's a little disappointing, right? Health officials have been warning us forever, it seems like, not to travel and to avoid large crowds because those together does what? Leads to surges a few weeks later. And unfortunately, there are too many people that were not really listening. Across the US, more than 1.5 million, 1.5 million have been screened at airports, according to the TSA. And that's a pandemic era record. The case numbers in Michigan are still rapidly climbing. We can turn them around, right? What do we do that? Avoid crowds, limit if you can travel, wear face masks, and don't hang out indoors with folks that are not from your household, right? And please get vaccinated when you can. It's again not over yet, but we can turn these numbers around fairly rapidly if we know and do what we're supposed to.
Such important information always, Dr. Nandi. Hopefully, people are listening. Thank you for your expertise and your time.